Hello guys, myself Gangaprasad Surendra Khandare and my topic is anti-arrhythmic drugs. In anti-arrhythmic drugs, we are going to see the class 4th anti-arrhythmic drugs. In class 4th anti-arrhythmic drugs, we are going to see the mechanism of action, uses, contraindications, adverse effects. So let's start the class 4th anti-arrhythmic drugs, that is the calcium channel blockers. What are the function of the calcium channel blockers? Calcium channel blockers decreases inward calcium current, resulting in a decrease of phase for spontaneous depolarization. They slow conductance in calcium current dependent tissues like AV node. What are the examples of the calcium channel blockers? That is verapamil and diltiazem. Why they are used as anti-arrhythmic drugs? Because they act on the heart only, not on the blood vessels. Another calcium channel blockers, that is dihydropyridine family, which are not used as anti-arrhythmic drugs because they only act on the blood vessels. Now the mechanism of action. They bind only to the depolarized or open channels, preventing of the repolarization. So they act only in cases of the arrhythmia because many calcium channels are depolarized, while in normal rhythm many of them are at rest. They prolong ERP of the AV node, resulting in a decrease in a conduction of impulse from atria to the ventricles. What are the uses? That is, they are more effective in treatment of the atrial than the ventricular arrhythmias. And second use, that is the treatment of the supraventricular tachycardia, preventing the occurrence of the ventricular arrhythmias. And the third main use, that is the treatment of the atrial flutter or fibrillation. They are contraindicated in patients with pre-existing depressed heart functions because of their negative inotropic effect. What are the adverse effects? They causes bradycardia and asystole, especially when given in combination with the beta adrenergic blockers. What are the beta adrenergic blockers? Beta adrenergic blockers are second class anti-arrhythmic drugs, that is that are nothing but the propranolol, atenolol, esmolol, etc. Now let us discuss about the uses of the anti-arrhythmic drugs, that is treatment of the atrial flutter or fibrillation, and then the second is treatment of the ventricular arrhythmia, the third is treatment of the ventricular tachycardia, and the first use is for the treatment of the atrial flutter or fibrillation. For the treatment of the atrial flutter or fibrillation, there are three methods. First, that is by reducing the thrombus formation by using anticoagulant warfarin. Second, by preventing the arrhythmia from converting to the ventricular arrhythmia. For that, the first choice of the drug, that is the class 2nd anti-arrhythmic drugs, they should used after myocardial infarction or surgery. They should avoid in case of the heart failure. The second choice is class 4th anti-arrhythmic drugs, and the third choice is digoxin, which is used only in heart failure of the left ventricular dysfunction. Third, that is conversion of arrhythmia into normal sinus rhythm. For that, there are various drugs, that is ibutylide, which is given as intravenously, and amiodarone, which can be given as intravenously as well as orally, and sotalol, which can be given as orally, and the another, that is a combination of the quinidine and digoxin, which is given as orally, and the propranolol, which is given as orally, or plecanide, which can be given as orally as well as intravenously. Another use, that is that for the treatment of the ventricular arrhythmia. For the treatment of the ventricular arrhythmia, the first choice, that is the class 2nd anti-arrhythmic drugs, which are given intravenously followed by the orally, which should be given early after myocardial infarction. The second choice, that is amiodarone, and the third use of all the anti-arrhythmic drugs are for the treatment of the ventricular tachycardia. For that, the first choice is lignocaine, which is given as intravenously. The second choice is the procanamide, which is given as intravenously. The third choice is the class 3rd anti-arrhythmic drugs, especially amiodarone and the sotalol. Now see the questions regarding this topic. The first question is, in ventricular tachycardia and stable hemodynamics, which drug to be used? And the options are propranolol, procanamide, quinidine, and verapamil. And the answer is procanamide. And the second, that is Mr. Green, developed an arrhythmia and was treated. A month later, he has arthalgia, fever, pleural inflammation, What was the treatment for the arrhythmia? The options are ismolol, class 3rd, procanamide, profenamide, and the answer is procanamide. Thank you guys.